Hi, I'm Danny Ecker with the Chicago Business Today Midday Report. Elgin-based Sherman Health Systems has announced a new partnership with Advocate Healthcare to help bolster its operating income after doubling its debt to about $300 million with the construction of a brand new hospital in 2009. Sherman selected Advocate over West Suburban Cadence Health System, a fellow Chicago powerhouse, which would have brought Cadence into an area outside of its focus. Our Andrew Wong is here with some context on the announcement. Andrew, what does this announcement and this alliance do for Sherman?
Well, it gets Sherman Advocate's scale, basically. Advocate is the biggest system in Illinois. It's got 12 hospitals, if you include its 2 children's hospitals. And basically that means that when it comes to any kind of contract negotiations on supplies or any kind of supplier, basically, Sherman is going to have Advocate's weight behind it.
So for Advocate, is this a big win for them? And then for Cadence, is this a significant loss not being able to sort of get into the areas where Sherman serves?
Well, in the hospital market, it's all about expanding geographic footprint, and definitely this does that for Advocate. They have a big footprint already, but this puts them farther out on the I-90, so to speak, than they have been before. So for Cadence, they have 2 hospitals, but mostly they're in the western suburbs. So they would have wanted to move into a more northwestern suburban position. So presumably, if that's still their goal, then they'd have to find some other way to do it.
And what about Sherman's patients or patients that are served in Sherman's area? Any effect that this could have on them as far as the care they get?
Well, that comes down to doctors. You know, doctors are in most cases they are, I mean, for all intents and purposes, independent contractors of a hospital. So they practice at a hospital, but they're not employees. So they actually have a freedom to move elsewhere if they want to. But if they like the deal with Advocate, then they might not change anything. So that sort of remains to be seen. But I think it comes down to doctors and what they want to do.
Okay, Andrew. Thanks for the time.